Hi, today I'm going to tell you a little bit about respiratory obstruction. I'm going to tell you some signs and symptoms, some complications of choking, how to do the Heimlich maneuver on an infant, how to do it on an unconscious patient, and a conscious patient. I'm also going to tell you the immediate care that needs to be done and the immediate hospital care that needs to be taken as well. Here's your bottle. Drink, drink, drink. Oh no, she's choking. She's turning blue. I would have somebody call 911 if there's anybody with me. But since there's nobody with me, I'm going to start the Heimlich. I'm going to put her legs by my arm, hold her chin, 4 blows, 1, 2, 3, 4. Turn her over, nothing, 2, 3, 4. 1, 2, 3, 4. Okay, she's no longer blue, she's crying, that means airway's painted. I would call the ER and probably take her in so that way she can be checked out. You have just watched the Heimlich done on an infant. Now these are a little more serious because infants are a little harder to do. But I'm going to tell you some of the steps to do the Heimlich on an infant. You place your forearm over your raised knees when you're sitting. Place the infant face down over your forearm. Give 4 blows using the heel of your hand to their back. Repeat till object comes out. If it does not work, turn the baby over. Place 2 fingers an inch below the imaginary line connecting nipples. Give 4 thrusts forcefully to bring out the object. If it does not work, you turn them over and start doing it again until they cough it out.
And coughing. So, how's the house coming?
It's coming along. How's moving to Lincoln or Omaha?
It's coming.
When are you actually going to move?
The 29th, 30th, or 1st.
Time.
A lot of miles on my car already.
I bet. What? Oh my God, she's choking. Call 911. Who knows how to do the Heimlich maneuver standing up? You have just witnessed a video of somebody choking on a grape. Now, some of the signs and symptoms she was showing were the grabbing at the throat and the fact that she couldn't breathe, and she got my attention. Now, how to do the Heimlich maneuver, you ask? Well, here's a step-by-step how to do it. First, you stand behind the patient. Then you form a fist with one hand and place the fist below the rib cage in an upward, the thumb inward. Hold the fist with the other hand and keep the arms off the rib cage. Give 4 inward and upward thrusts and repeat until the object is ejected. Tiffany, we're going to get up for lunch today. Tiffany. She's turning blue. Call 911. 1, 2, 3, 4, 5. Just witnessed a video of a person that was unconscious and they were choking on a grape. Now, it's kind of the same as doing the Heimlich on another person, but this one is laying down and unconscious, so they can't really tell you what's going on. So, to do the Heimlich on an unconscious patient that is laying down, you straddle the person with your knees, and then you place one hand above the waistline, just like you would for the chest. And then you place your other hand over top. You give 4 inward and upward thrusts, and you repeat until the object is coughed out. And then you maintain and make sure that they are breathing adequately. Some signs and symptoms of respiratory obstruction is struggling to breathe, grasping for air, so they could be going, coughing, as everybody knows what coughing sounds like, gagging, and the face and lips could be turning blue. They could also be grabbing at their throat like this, which that is the universal sign of choking. So if you see anybody doing that, that is a big indicator that they are choking. There's many complications of choking. One, the worst possible complication is death. Now there's several other ones as well. There's brain damage, which is caused by lack of blood and oxygen flow to the brain. Collapsed lung, which may occur when airflow through one of the bronchi is completely obstructed. Loss of consciousness, caused by reduced blood flow to the brain. Pneumonia, which pneumonia may occur when small particles containing bacteria remain in the respiratory tract and enter the lungs. So those are a few of the complications of choking. So, some immediate care for a respiratory obstruction is you call 911. Give up to 5 blows between the shoulder blades with the heel of your hand. If the person is not pregnant or too obese, then do abdominal thrust. If the patient is pregnant or too obese, do a high abdominal thrust. And then you give CPR if necessary. Some immediate hospital care is CPR if necessary, and assess patient's airway and breathing. Monitor the patient very well. Thank you for listening, and I hope you learned something out of respiratory obstruction.